Hemophilia is a very famous disease, not least because it runs in several royal families in Europe and it's known as the royal disease. For example, the only son of the Tsar Nicholas II, the last Russian Tsar of the 20th century, had this disease, and many people attribute the very strong influence of Grigory Rasputin on the Tsar's family due to his apparent ability to control the hemophilia at the son of the Nicholas II. What is the modern approach to hemophilia, and what are kind of the key management criteria for patients with hemophilia, and what can be done to prevent its numerous complications?
Yeah, I think hemophilia has just about the most interesting history compared to any other disease, and not just in terms of its influence on politics and geopolitical environment, but also its medical history and how it has really changed over the last 100, 200 years that we've had any inkling about what this disease really is. So in the modern era now, we recognize that hemophilia is due to a factor deficiency. In fact, we're talking about clotting factors that help people clot and form scabs and stop bleeding. So for a hemophilia patient, they're missing a clotting factor, and we can determine the cause of that on a genetic basis and see what gene is mutated or missing. And then we can actually now replace that missing factor and virtually eliminate the disease. Now, this is medication that's given on an ongoing basis, but if you're able to keep the factor levels to a normal level, patients don't bleed anymore and they have normal lives. However, if you take away that factor, they will bleed, and they will bleed not just with trauma or surgery, but severe patients will bleed spontaneously. So they can be lying in bed and suddenly have a bleed in their knee, their hip, their abdomen, wherever it may be. So the modern treatment now is all about factor replacement, and we have many different factors that are available and very effective.
What are some of the complications of hemophilia? And you mentioned that it's a result of the excessive bleeding, sometimes spontaneous, but what is something that people have to watch for example, if they have the disease?
So there's two arms to complications here. The first one is more historical. So this is the fact that in the 1980s, many of the factor products came from human-sourced plasma, and they were contaminated. They had hepatitis, hepatitis B, hepatitis C, and HIV. And this really decimated that community. So about 1/3 of hemophilia patients contracted these diseases, and many died. Now, starting in the 1990s, we have developed recombinant factor products. So these are no longer human-sourced, and therefore there is no possibility of contracting human-transmitted diseases. So they're much safer. And now, as the generations are shifting, we are really not seeing that complication as much anymore. But instead, what we're seeing is the main complication being inhibitors. So an inhibitor is an antibody that your own immune system makes, and it attacks factor.
So it is, in fact, the reaction of the body to the treatment in the sense of the drug-induced autoimmune disease.
That's right. That's right. And it's very similar to something else called acquired hemophilia. And now in acquired hemophilia, these are patients who are not born with hemophilia. But later in life, their immune system starts to make an antibody that attacks their own factor. And so they become hemophiliac. But typically, this is something that occurs in patients who are born with hemophilia, and after several or many treatments of factor products, they develop almost like an allergic reaction to that product, so that the antibody, their autoantibody, is attacking the treatment. It makes the treatment much less effective. So if they're making too much of this antibody, no matter how much factor we give them, it won't work. In those situations, we have to give a bypass agent. So we give a treatment that circumvents the missing factor and the antibody, the autoantibody, the inhibitor. There are only two products that are available that do this. One is an activated factor 7A. The trade name used here is Novo7. And the other one is a combination of different activated factors, 2, 7, 9, and 10. We call this FIBA, the trade name being sort of a play on words, because FIBA is factor 8 inhibitor bypass agent, FIBA. So these are the only two products. And if you look at those factors and the clotting cascade, you're finding a mechanism of bypassing where the breakdown exists. So these would work in just about any bleeding disorder because they're kind of, jump starting a whole clot. But they do run the risk of causing blood clots, and they're not quite as good in patients with inhibitors as the original treatment was. So if it's best to avoid having an inhibitor if it's at all possible.
Is it possible to avoid this? Is there anything that patients can do? Is just happens on a random basis?
We don't fully understand why it happens. So there are clearly certain genetic mutations that confer a higher risk of developing an inhibitor at some point in life. And that's probably why inhibitors tend to run in families. They also happen mostly in children and not adults. But if the inhibitor presents itself, we try to get rid of it by immune tolerance induction. This is immunotherapy, and hope that it doesn't come back. Quite often that's impossible and it stays for life, in which case those patients really can never get factor replacement. They always have to get the bypass agents. We know it happens more in severe patients than in mild patients. We know it happens more in hemophilia A than in hemophilia B. The difference of hemophilia A is that it's a factor 8 deficiency, whereas in hemophilia B it's a factor 9 deficiency.
I think Tsarevich Alexei had a hemophilia B.
That's right. And we didn't know that for decades, because actually it was only in the 1950s where they realized that there were two different hemophilias. It was recognized that there was a missing factor because clinician scientists could mix plasma from a hemophilia patient with somebody who didn't have hemophilia, and it would correct. Their clotting times would correct because the missing factor was replaced. A very bright scientist down in Brazil, she mixed plasma from two different hemophilia patients and found that they both corrected each other.
So they had something in each other's plasma that corrected for the deficit of the other.
That's right. Yeah. And that was the initial realization that there was a hemophilia A and a hemophilia B. And then the following year, a group in Britain collected a series of patients who they found were these hemophilia B patients. They named the disease Christmas disease because the first patient's last name was Christmas.
I see. Not due to Christmas at the end of the year, but the patient's last name.
Well, it was a little confusing because the publication came out on the week of Christmas.
That's a good story, as many stories are in medicine.